Next.
Hi, I'm Dr. Bruno,
Hi, I'm Hollis Silverman.
and today we're going to talk about finding the appropriate mental health professional for you. I know that we've all experienced sometime in our life a friend or a family member coming and asking us for some assistance in finding a mental health professional. And I know even today when people ask me, being a mental health professional, I always take pause and have to think about what mental health professional to refer to them, because in my opinion there are so few that are appropriate for whatever my friend is asking me to find them for. So if it's about depression, finding the right therapist that can work with depression, and so on and so forth. So but the very first thing I do is suggest that they go to their insurance carrier and find out or get a list of names that their carrier has, and then bring that to me or bring that to either their primary care physician or other trusted individuals in their lives to see if they know if there's any overlap of people that they may know, and whittle it down from there. So at that point, I want to ask them also how, is it an emergency? Because, do we need to take them to the hospital, or do we have some time to do all of this recognizance? And if we do, then hopefully we can get it down to, if we're lucky, 1 to 5 names. Sometimes there's no names, and then we have to start back at the drawing board. But once we get it down to one of those 5 names, now it's time to sit down and make those phone calls and to see what is a good fit over the phone.
Okay. So yeah, after you go through that process, you're at the phone and you have questions to ask. So you start asking the questions, and some of the key questions that you want to ask the mental health professional is, what are their fees? Maybe not the first question, but it's always something that you want to know. So if you're paying out of pocket, maybe do they have a sliding scale? Do they take your insurance? That's always a question. I would also say another question is, are you licensed in the state of Florida? Just making sure they have a valid license that they can practice here is always a good thing, and just for your own sake, so that you know that they are professional, that they know their areas of expertise. And speaking of areas of expertise, I would always ask. So, for example, I have, let's just say, depression or anxiety, or I'm coping with bereavement. If you're asking that question, you want to say, do you have any specialties, or have you worked with clients before that have these specific issues? That's always something that's good to know. So I would ask that question.
A lot of my substance abusers ask me that, like, have you ever had difficulties with substance abuse? Which I find comical, but because we're always taught that it's not about the experience. If you're empathic, you can help anyone through any experience. It's the other person who's asking really, can you understand my pain? And I think we all can understand pain, because at some point in our lives we have experienced it, and we will experience it. So, and that is something I sort of find that common ground. But yeah, you're right. Those are really appropriate questions to ask, along with some more tedious ones, which would be scheduling. So that's very important. If you can't see your therapist on a very regular schedule, then even if they're the best therapist, they're not the right therapist for you. And sometimes that can be very painful too.
Absolutely.
So now that you've whittled it down to maybe 1 or 2, and you've picked the first one to go to for that first session, I always tell my clients to commit to 3 sessions. My expression is like, therapy, your therapist is like a pair of shoes. If they pinch after 3 sessions, then you need to return them. And I will help you return me and find somebody else.
Yes.
So you're not going to walk in shoes that pinch you for 12 miles. You're going to be really upset. And the same thing will happen if you spend 2 years in therapy with the wrong therapist. You're going to be really upset. So, and during those 3 sessions, there are some very important qualities about the therapist and about the working relationship that you need to be mindful of in order to make that that decision at the end of that 3rd or 4th session. Some of those qualities are, as Hollis will outline.
Some of those qualities are: do I feel that this clinician is non-judgmental? Do I feel comfortable around them? Do I feel safe to tell them my interpersonal and most treasured secrets? Do I feel like they are specialized and they know they're experts in their field? Do they really know what they're doing? I guess in a way. Do I feel like they can relate to me? Do I feel like they're culturally competent?
Yes.
Do I feel like they're insightful? Do I feel like they can really give me good feedback? Do they provide me with homework when I leave? Or do they give me things to think about after I leave?
And are you thinking about them when you're not in therapy?
I'm a huge believer. It is not just what you do inside of therapy. It's 10 times more important what you do outside of therapy. But that's what you're getting. What you get in therapy is what you also give. So if you put yourself into it, you're going to get a lot out of it, but you also have to practice it outside of the doors. But as Dr. Bruno mentioned, it would be a shame to do that with somebody who maybe isn't the right fit for you, that you've been with for 2 years, when you kind of could have just eliminated that process, after 3 sessions, as Dr. Bruno does, and after I get that same contract with my clients as well.
And an ethical therapist will do that. It's not about the therapist, it's about the client. So you're coming to us for help. We're not coming to you to give our help.
Absolutely. That's very true.
Yes. And one of the best things as a therapist, and usually it tells me that therapy's going to end soon, is that when a client comes to me and says that they hear my voice inside their head now. The reason why I find that so important and a signal that therapy's about to end is because most of our experiences are then processed and into cognitive thought or old tapes, as I would say, or many of us would say. So those old tapes dictate our behavior. And so if you're starting to hear my voice, you're hearing new tapes. And that is progress and that is change. So if you have those new tapes, now you can go forth and as we say, prosper. Very much so.
That's music to my ears when I hear that from clients. That is music. So,
but thank you.
And we look forward to hearing from you soon.
Yeah, stay tuned.